Pay close attention to the color of your urine. It might look watery white, light yellow, golden, brown, reddish or dark red, and sometimes even purple or green. Look out for blood in the urine as it is a warning sign. Blood doesn't belong there. It might be a urinary tract infection, an enlarged prostate, cancer of the prostate, bladder, ureter, kidney, or kidney disease. In this video, you will learn about microscopic traces of blood and substantial bleeding, which is easy to recognize. I will tell you what to do when it happens and when to relax. In any case, this is something you want to see a urologist for. Hi, my name is Stefan Buntrock. I'm a urologist and sexologist, and I am happy to share with you my professional knowledge in urology and sexology. Blood in the urine is called hematuria. It might be microscopic. In this case, it is not visible to the naked eye, but if you do a dipstick test, there is an indicator on it for detecting small amounts of blood. This test comes in handy because when you are dehydrated, the urine becomes very dark and sometimes even reddish without containing any blood. But if urine looks red, many times because there is some blood in it. Blood is a powerful color. 1 drop mixed in 1 liter of water is enough to be very well visible, so it mostly looks more dramatic than it is. However, if you can't see it, it is time to go to book an appointment with your urologist right away. The first thing I do in these cases is ask for symptoms, because if there are symptoms, there is a good chance it is a urinary tract infection. If there are no symptoms, this is another warning sign that there might be something bad going on. So I check the urine for blood and possible infection with a dipstick test and urinary culture, and also look at it under the microscope. I want to see how many erythrocytes there are and what appearance they have. If blood has its origin in the kidneys, the erythrocytes will be deformed. Additionally, bacteria will be visible under the microscope, and with the help of a little drop of blue dye, I am able to assess the cells in the urine whether they look like cancer cells. Then I will perform a thorough examination with ultrasound of the prostate, the bladder, and the kidneys. In many cases, I will need to look inside the bladder with a small camera to check for anything that doesn't belong there, such as bladder cancer. Hematuria doesn't always equal cancer. There are some benign conditions linked to it. I just mentioned urinary tract infections. And there are others. Bladder stones, for example, or kidney stones. There are diseases of the kidneys which go along with hematuria, like polycystic kidney disease. Then there is trauma to the urinary tract, which may cause bleeding. Microtrauma happens during strenuous exercise, and exercise-induced hematuria, also known as runner's hematuria, is quite common. This is a benign condition, nothing to worry about. But at first, any blood in the urine has to be looked at. In the beginning of this video, I mentioned the dipstick test. The test is important because sometimes when urine is red, blood is not the reason. Certain foods may cause harmless discolorations. Beetroot is known for the effect. The same when you have eaten loads of raspberries. Do the same with blueberries, and the color of your urine might turn pink. Also, certain medications may cause the color of your urine to shift. Amitriptyline may give it a green color, metronidazole a brown, almost black color. And if it is very yellow, vitamins might be the reason. However, if you don't take vitamins and it still looks bright yellow, you might have a problem with your liver or gallbladder. Thanks for watching. Bye bye.